2 in 3 people over the age of 60 have at least one fingernail right now that is quietly telling them something is wrong inside their body. Not a fungus, not a vitamin deficiency they can fix with a pill from the pharmacy. A real, measurable warning from an organ that is failing slowly. And the person looking at that nail has absolutely no idea what they are looking at. In January of 2025, a clinical paper published in the British Journal of Dermatology gathered the data from over 14,000 patient examinations and confirmed something most internal medicine doctors already accept privately. The fingernail is one of the most overlooked diagnostic surfaces in adult medicine. Roughly 70% of systemic diseases that develop after the age of 60 leave a visible mark on the nail months and sometimes years before any other symptom appears. The fingernail grows about 3.5 millimeters per month, 3 times faster than the toenail. That means whatever is happening inside your bloodstream right now will be readable on your fingernail in roughly 6 weeks. And whatever you see today started about 3 months ago. The nail is a printout. Your body has been handing you the report card. Nobody has taught you how to read it. I am not saying this to alarm you. I am saying it because the 15-minute appointment you get with your primary doctor will not include a hand examination. Your doctor will check your blood pressure, ask you about your medications, and send you home. The nail signs will be sitting there in plain view, on the desk between the two of you, and nobody will look down. This channel exists to teach you what your appointment will not. There is no financial incentive in the system to keep you well after 60. Only to medicate you once the disease has progressed to a billable diagnosis. Subscribe and hit the like button right now. I am Marsden Hale, and we are building toward 1,000 subscribers. Every single one matters. Before I go into the 7 signs, I want you to do something. Right now. Pause if you need to. Put your hand flat on a clean surface, palm down under a good light. Fingers spread, relaxed. Look at all 10 fingernails together, not one at a time, all 10. The pattern matters more than any single nail. The body sends signals in waves, and the nails record them in sequence. When the body is healthy, all 10 nails look essentially the same. Smooth surface, faint pink color through the bed, a thin pale half moon at the base. Any deviation from that baseline is a question your body is asking you. Today we will answer 7 of those questions. Sign 1. The first sign is the half and half nail. Look at the nail bed from base to tip. In a healthy nail, the entire bed shows a uniform faint pink color through the keratin. In the half and half nail, the bottom half of the bed is pale, almost white, and the top half is a deep brown or reddish brown band that extends to the tip. The dividing line is sharp. It looks as if someone painted the upper half a different color. This pattern is called Lindsay's nails. In adults over 60, it is associated with chronic kidney disease in over 80% of cases. The kidneys are quietly losing the ability to filter waste, and the elevated urea in the bloodstream is changing the pigmentation of the nail bed itself. There may be no other symptom yet. No swelling, no back pain, no urinary changes, just the painted line. If you see this on more than 2 fingers, ask your doctor for a basic metabolic panel with creatinine and an estimated glomerular filtration rate. It is a routine test. It will tell you in 24 hours whether your kidneys are in early decline. Sign 2. The second sign is the spoon nail. Hold your hand out, palm down, and look at the nail from the side. In a healthy nail, the surface curves slightly downward from the center toward the edges, like the back of a teaspoon. In the spoon nail, also called koilemechia, the surface curves the opposite way. The center sinks and the edges lift. If you placed a drop of water on the nail, it would not roll off. It would pool in the center. This is one of the oldest and most reliable signs in medicine. It points almost always to iron deficiency anemia. In adults over 60, the most common cause of iron deficiency is not poor diet. It is slow, hidden bleeding from somewhere in the digestive tract. A small stomach ulcer, a colon polyp, something that loses a few drops of blood every day without ever producing visible blood in the stool. The body slowly runs out of iron, and the nails start to deform because keratin requires iron to harden properly. If you see a spoon nail, the test you need is not just a complete blood count. You need ferritin, iron saturation, and an honest conversation with your doctor about a colonoscopy if you haven't had one recently. Spoon nails, in a 70-year-old man in particular, are a colon cancer screen until proven otherwise. Sign 3, the third sign, is clubbing. Look at the angle where your nail meets the skin at the base. In a healthy person, there is a small visible angle. The nail comes down, then the skin comes up, and there is a gentle dip between them. In clubbing, that dip disappears. The fingertip swells slightly. The nail itself starts to curve like the back of a small dome. If you press your two thumbnails together, base to base, in a healthy person, you will see a small diamond-shaped window of light between them. In clubbing, that window closes completely. This test is called Schamroth's window, and any internal medicine resident in the world can do it on you in 10 seconds. The conditions that cause clubbing are not minor: chronic lung disease, lung cancer, severe heart valve problems, inflammatory bowel disease. If you see clubbing developing on your own fingers, this is not a wait-and-see situation. This is a request a chest X-ray and an echocardiogram this month situation. The good news is that clubbing reverses when the underlying cause is treated. But the underlying cause must be found. Sign 4. The fourth sign is the dark vertical line. Look closely at each nail for a thin dark stripe running from the base of the nail to the tip. It can be brown, dark brown, or nearly black. In people with darker skin tones, a thin, even line on multiple nails can be normal and benign. The concern is the line on a single nail, especially if the line is wider than 3 millimeters, if the color is uneven, or if the pigment extends into the skin around the nail itself. That extension into the skin is called Hutchinson's sign, and it raises the concern for a rare but aggressive form of melanoma called subungual melanoma. This cancer is often missed for years because patients and even doctors assume the line is a bruise. Bruises move up the nail as the nail grows and disappear within 3 months. A pigmented line that does not move, or one that grows wider, must be evaluated by a dermatologist. Do not photograph it once and forget it. Photograph it today, photograph it again in 8 weeks, and compare. If anything has changed, you need a biopsy. Caught early, subungual melanoma is curable. Caught late, it is one of the most aggressive cancers in dermatology. Sign 5. The fifth sign is the deep horizontal groove. Run your fingernail across the surface of each nail bed and feel for a deep furrow that cuts across the nail from side to side. These are called Beau's lines. They are not cosmetic. They are scars. Each one marks a specific moment in time when the body was under enough stress that nail growth temporarily stopped. The groove is the gap. The nail then resumed growing on the other side. Because the fingernail grows about 3.5 millimeters per month, you can date the event almost exactly. A groove 3 millimeters from the base happened about 4 weeks ago. A groove 6 millimeters from the base happened about 8 weeks ago. Beau's lines after the age of 60 are caused by serious illness, a heart attack, severe infection, chemotherapy, uncontrolled diabetes, or a sudden drop in blood pressure during surgery. If you see Beau's lines on multiple fingers, your nails are telling you that something significant happened a few weeks ago. Sometimes the patient remembers, sometimes they do not. Either way, it is worth asking your doctor what may have caused it, because if it happened once silently, it may happen again. Quick question before I continue, because this honestly shapes the next videos in this series. Looking at your own hand right now, how many of the first 5 signs do you actually see? Write the number in the comments. 0, 1, 2, 3. I read every comment in the first 24 hours. Your answers tell me what to cover next. Sign 6. The sixth sign is the white band, not a vertical line, a horizontal white band that crosses the nail bed. There are two specific patterns. The first is called Muirche's lines, two thin parallel white bands on multiple nails that do not move when the nail grows. They appear to be in the nail, but they are actually in the nail bed underneath. If you press on the nail, they fade. Muirche's lines in adults over 60 are strongly associated with low blood albumin, which usually means liver dysfunction, kidney protein loss, or severe malnutrition. The second pattern is called Mea's lines, one single solid white band that crosses the nail and moves up as the nail grows. Mea's lines are most often associated with heavy metal exposure, arsenic poisoning, or severe systemic illness. They are rarer than Muirche's lines, but more dangerous when present. Either pattern deserves a basic blood panel that includes albumin and a heavy metal screen if there is occupational or environmental exposure history. Sign 7. The seventh sign is the surface that breaks the rules. Pits, ridges, splits, crumbling tips, brittle nails that flake. Each of these tells a different story. Multiple small pits across the surface of several nails, looking almost like the nail is tapped with a needle, is the signature of psoriasis or psoriatic arthritis. The joint disease can begin in the nails years before the joints become painful, and recognizing it early changes the entire treatment timeline. Long vertical ridges that run from base to tip are usually a normal part of aging and are not concerning on their own. But if the ridges are deep, sharp, and accompanied by splitting at the tip, that points to a thyroid problem, most often an underactive thyroid. Brittle nails that flake and crumble in older adults are most often a combination of inadequate dietary protein, low biotin, and inadequate water intake. Sometimes also a thyroid issue underneath. The fix is internal, not topical. Hand cream does not reach the nail matrix where the keratin is built. Only the bloodstream does. Now I want you to do the second part of the self-check. Look at your hand again. Count how many of the 7 signs you see, even partially. Write that number down. Then ask yourself one more question. Are you seeing the same sign on multiple nails or on a single nail? Multiple nails on multiple fingers is almost always a systemic message, meaning something in your bloodstream is changing. A single nail with a single sign is more likely a local issue, a trauma, an old injury, an isolated fungal infection. Pattern recognition matters more than any single observation. Step 1. The first protocol step is the foundation. Adults over 60 need 1.2 to 1.6 grams of protein per kilogram of body weight per day. That is significantly more than the standard guidelines suggest. Keratin is protein. If you are not building enough keratin in your bloodstream, your nails cannot rebuild themselves no matter what you put on them topically. 3 protein-anchored meals per day, eggs in the morning, fish or lean meat at lunch, legumes or meat at dinner. Most adults over 60 eat half of what they actually need. Step 2. The second step is iron, only if indicated. Do not start an iron supplement on your own. Excess iron in older adults is toxic to the liver and the heart. Get the ferritin test first. If your ferritin is below 30, then a slow-release iron tablet taken with vitamin C every other day, not every day, is the most absorbable protocol. If your ferritin is normal, the brittle nails are not from iron. Move on. Step 3. The third step is the silent multiplier, hydration. Adults over 60 consistently drink too little water. The body pulls water from the lowest priority tissues first: skin, hair, and nails. Aim for 2 liters per day, more if you're active. Within 4 weeks of consistent hydration, the keratin quality of your nails will visibly improve. It is the single cheapest intervention in this entire video, and most people skip it. Here is the trap that catches most people. You watch a video like this, you look at your nails, you see 2 or 3 signs, you panic, and you order a kit of every supplement on the internet. You take them for 3 weeks, You see no change, you stop. The fingernail grows 3.5 millimeters per month. It takes a full nail 4 to 6 months to grow from the base to the tip. That means even if you fix the underlying cause perfectly today, the nail you are looking at right now will not show clear improvement for at least 2 months and full replacement for nearly half a year. Take a photograph of your hand today. Take another in 8 weeks. The base of the nail at the cuticle is your real evidence. New growth tells the truth. The old nail surface is the past. I want to be direct with you. If you see clubbing, a single widening dark vertical line, or Beau's lines across multiple fingers, do not wait for a routine annual check. Call your doctor this week and request a specific evaluation. Bring this video or bring a photograph and ask for the test by name. A 15-minute appointment will not catch what we just covered. You have to bring it to the table yourself. How old are you? Write your age in the comments. I genuinely use this to decide which conditions to cover in the next videos. If you are 60, most of what we discussed is reversible. If you are 70, it is manageable with the right intervention. If you are 80, some of it is advanced, and the priorities shift toward protection rather than reversal. Your age tells me where to aim next. No clinic appointment is going to walk you through what we just covered. There is no profit in teaching you to read your own nails. Help Dr. Hale reach 1,000 subscribers. Subscribe, leave a like, and send this video to one person in your life who has ignored their own hands for years. The body forgives a great deal if you act in time. Do not wait. It will not pass. It will only progress. I am Marsden Hale.